Hi, I'm Lucy Caldwell, the Director of Communications for the Fairfax County Health Department, and we're here to talk today with Rachel Chumpitaz about back to school vaccinations. It's that time of year. Fall is right around the corner, and it's a good idea to make sure that you're making your appointments as soon as possible, if you haven't already made them, to get your children vaccinated. Vaccines are among the best ways to prevent disease for people in our community, and there are many vaccine preventable diseases. The health department team, like Rachel, works very hard to ensure that we educate, we inform, and we provide resources for everyone in the community, no matter what your age, to receive the proper vaccinations. Everyone in our community deserves to be healthy, and we all benefit when children and adolescents are fully vaccinated. Getting vaccinated is like updating your computer. Vaccines are like software, and they contain information for our bodies to improve their performance. Just like computers know how to detect a virus, the body can also know how to detect and react to a virus even after the vaccine has left the body. So, Rachel, tell us a little bit about yourself and about being a public health nurse and working with kids.
Um, I've been a nurse for 15 years and I have joined the Fairfax County Health Department just a little bit over 2 years ago. I work out at our Herndon Reston district office location, which majority of our services that we offer is really childhood immunizations, about a little bit over 80% of our services. So we really work closely with the parents and the kids, educating them about childhood immunizations and school required vaccinations.
Why are vaccines important?
So, for more than 50 years, vaccinations have saved over a billion lives and prevented countless illnesses and disabilities in the United States. Vaccine preventable diseases such as measles, mumps, whooping cough, or pertussis are still a great threat. They continue to infect children in America, resulting hospitalizations and deaths every year.
What are some of the trends you're seeing as far as people getting vaccinated or not?
The trend I'm seeing is low compliance of vaccinations. During the pandemic, people have delayed in going to the doctor to get their vaccines, which resulted in a great number of children who are not up to date with their routine immunization.
That is concerning. What are some of the consequences or potential realities if parents don't get their children fully up to date on immunizations?
So, if children aren't vaccinated, they're at higher risk of contracting the disease and they can spread the disease to others. Disease can spread to another child who is too young to get vaccinated, or it could spread to a person with a weak immune system. Now, vaccination protects children from serious illness. Vaccine prevents diseases that can lead to hospitalizations, hearing loss, pneumonia, convulsion, brain damage, a loss of an extremity, and or death.
You mentioned that there was a gap during the pandemic.
Mhm.
So, what happens if a vaccine is delayed? We don't want people to feel bad. We want people to get caught up and catch up and come on in and make these appointments. So, what if it's delayed? What is your message to parents?
So, if a vaccine is delayed, the child is more vulnerable to catching the disease. The child is not fully vaccinated until they have received all and completed all the doses of the vaccine. And, you know, that's why you should really schedule to come in. And we at the health department can catch up the child. We can follow the catch up schedule of the vaccination to ensure that the child is fully vaccinated.
We read so much on the internet, especially during the pandemic, right? About health conditions, diseases, symptoms of health issues. So, some people have read a lot of different things about different kinds of vaccines and immunizations. So, are there long term side effects to the vaccines that we provide to children?
There have been no notable causes of long term side effects of the vaccines. As far as, reading a lot of information, all I can say is that make sure you get your information from a reliable sources, like from your local health department or the Virginia Department of Health, CDC, or even at www.vaccineinformation.org.
Great, thank you. We do try to put our information out on social media as well, Instagram, Facebook, even Twitter. And the Fairfax Health Department website is a good source. We try to make sure that we keep it up to date so our residents, our families will be aware of how important it is to get immunized, get vaccines for your children. Where can parents take their children to get vaccinated now?
So the parents actually have multiple options right now.
Mhm.
They can make an appointment with a pediatrician or their primary care doctor or at your local health department. Any required vaccines are free of charge at the health department. So this is why I suggest make the appointment as soon as possible and not to wait until the last minute. Here at the Fairfax County Health Department, luckily we have 5 locations where parents can schedule the appointments for vaccines. Herndon Reston office is where I'm based, and then Fairfax, which is the Joseph Willard Health Center. There's the Annandale District office, the Springfield District office, and the Mount Vernon office. These offices, we also have extended our clinic hours, including Friday afternoon clinics. Also, we have 2 Saturdays that we will again open for back to school immunizations. So on August 5th, the Herndon Reston location and the Annandale location will be open for scheduling for back to school immunizations. And then on August 12th, the Fairfax or Joseph Willard Health Center and Mount Vernon District Office will also be open for back to school immunization. In addition to that, all 5 locations also have extended hours the week before school starts. So in August 14th, 15th, and 16th, our clinics will be open from 10 a.m. to 6 p.m. And this is, going to help a lot of those working parents that they can just come in after work and then we can see the children and, make sure they are vaccinated and up to date. So there are plenty of opportunities for the parents to schedule their child for an appointment at any of our locations.
Thank you, Rachel. We
Thank
really
you.
appreciate everything you and your team is doing to make sure that children are safe in schools and making sure, in essence, that our entire community is safe and disease free. So, is there anything else you'd like to add or any advice for parents as we realize everybody's busy, the summer fun, summer vacations? Is
Mhm.
there any advice you have?
Yes, prepare your child for immunization. Don't scare them by coming here. Just let them know they're coming to the clinic for vaccines. Bring any vaccine records you have at home. That way we can vet and review the records, and don't forget to turn in the records to the school after the child is vaccinated so that the school can have the updated records. Schedule the appointments today. Do not wait until the last minute because it can delay your child starting school this upcoming school year.
Thank you so much, Rachel, and thanks for everything you're doing to make our community healthy.
Thank you. Thank you. It's my pleasure.